Good evening, everyone. Welcome to You and Your Health. We're excited to have you join our program this evening. My name is Erika Roberts, a co-host of this program, and I have my other co-host, Dr. Edward Isuman. Dr. Eddie and I are very excited to have you join us this evening, as our topic this evening is sharing your experience COVID-19 vaccination. As you all know, globally, even with the several vaccines that have been approved worldwide, COVID-19 infections continue to rise. We had one of the largest, or highest, I should say, vaccinations globally a few days ago, but still, there was still a high number of infections. Here in this country, there was over 200, have been, I should say, over 200 million people that have received their first dose, but we still have a long way to achieve herd immunity in this country and globally. So we have four very special guests this evening, four of our very own from Ebenezer Methodist Church, who will share their experiences, reasons for receiving the COVID-19 vaccine, and their recommendations to you, our viewers, regarding obtaining the vaccines. And since we have several guests, we will get right into our conversation. And we're hoping our viewers will join and share their experiences as well, in terms of your experiences getting the vaccine, or ask questions to our panel in aid of helping others to also get the vaccine. So before we get started, we would like to thank our last guest, Dr. Barbara Inswa, for the wonderful discussion she had last week on how we should take care of our health and the tips she gave us for managing our medication in hypertension. If you haven't watched that segment, we suggest you do so, and please share the link with others. She has ordered about 25 books, order more. Here's her book, A Woman's Guide, that she discussed during the last discussion. So if you are interested, you can see myself, Dr. Eddie, or Auntie Jane, Auntie, who will be also on the program this evening, and we'll get the book to you. So Dr. Inswa, as I mentioned last time, will be back in May to have a discussion on cervical cancer, a topic that's dear to both she and I, and so we hope that you'll be able to join that discussion next month. So now let's get started with this evening's discussion. As I mentioned, we have four special guests: our uncle and brother, Mr. Fifi Bediako, our mother, our aunt, Mrs. Alberta Stevens, our auntie and sister, Sister Martha Upon, and our mother and aunt, we sometimes call her sister as well, Auntie Jane Kosa Auntie. All four of them are very modest in church, but they have accomplished a lot. So I'd like to share some of their experiences, their professional lives, I should say, before we get started with this discussion. So our very first guest is our uncle and brother, Mr. Fifi Bediako, Society Steward for Administration at Ebenezer. Mr. Bediako is from Cape Coast, Ghana, and migrated to the United States nearly 30 years ago. He obtained his bachelor's degrees in business administration and criminal justice from the University of Maryland, College Park, and a graduate degree in healthcare administration with specialization in management studies from the University of Maryland Global Campus. He is currently working as a research assistant data analyst in Rockville and work part-time with the Disability Administration in Silver Spring. He's currently pursuing a doctorate degree in public health, specializing in epidemiology from Walden's University. He is the past assistant secretary for the previous administration of Methodist Church Choirs North America. As busy as he is, he occasionally provides support and data analyst as a consultant in Accra. Our next guest is our mother and auntie, Mrs. Alberta Stevens, also from Cape Coast, and a graduate of Wesley Girls Elementary and Agri Memorial Secondary School. Mrs. Alberta Stevens received her university education from Southeastern University and was a benefit analyst for 25 years at Howard University until her retirement 5 years ago. She has held numerous positions at Ebenezer, including EMC, acting lay chairman, choir secretary for 30 years, finance committee and property procurement committee, member of the welfare committee as well. She currently serves as Ebenezer's leaders meeting secretary. So our third guest, that's Auntie Alberta. Our third guest is our auntie and our sister Martha, the Society Steward at Ebenezer. He's a public education teacher and has been teaching middle schoolers for the past 18 years. Sister Martha received both her undergraduate and graduate degrees from the United States. She obtained her master's degree in English language development and curriculum and instruction with a focus in administration from the University of Maryland, Baltimore County, and McDonald College. She loves and loves teaching, as it allows her to learn from different cultures and learn what is expected of our youth and our young adults. So let us welcome Auntie Martha as well. Hello, Auntie Martha. Our last but not least guest is our mother and our auntie, our society steward, Auntie Jane Kosa Enti, also an alumni of Wesley Girls, but this time the secondary school. Auntie Jane received her basic education in Ghana and completed her nursing training here in the United States. She has been a registered nurse for over 25 years, and her specialty for the past 20 years has been in geriatric care, specifically home health care. She was attracted to this form of nursing as it gives one an opportunity to observe and treat clients in their home environment, where they can receive one-on-one teaching, which empowers them to better manage their disease, medication, and their overall care. She currently serves as the Administrative Director of Operations for her agency and has been doing that for the past 7 years. So we're excited to have all of you join our program this evening. Hi, Auntie Jane. I hope everyone is doing okay, and thank you for taking time out of your busy schedule to be part of this very important discussion. So we want to make this discussion as a conversation. So please feel free to expand on any other questions that Dr. Eddie and I would ask you all. And we're hoping that each panelist will get a chance to respond to that question. So we can get started. As I mentioned, all our 4 guests have received their COVID-19 vaccination. So Dr. Eddie and I will have some round of questions, and we'll like to hear, as I said, the viewpoint of all of you. So I'll go ahead and start the first question, Dr. Eddie. Okay. So I think we had a little bit of discussion prior to the programs that began. There's a lot of vaccine hesitancy out there, some of them which are myths, which Auntie Martha had a comment about backstage, but some are also truths. So we want to know whether you all had a hesitancy in receiving the vaccine. So Auntie Martha, I would like to start with you, whether you were hesitant when it was time for you to get your first dose. I think she's muted, Eddie.
Oh, okay. I think she can unmute herself.
Okay. Auntie Martha, you're beautiful. Okay, perfect.
Thank you. Yeah. Thank you very much. Yeah, it's true. I'm glad I have both my first and second vaccinations. When it first came, I was very hesitant. I didn't want to do it for many reasons. There were things about Black folks will die after we take the vaccine. But I had to do it because I had no choice because of my job. Just going to school in the building, and the kids were coming without their vaccinations. It was a challenge, but I had to do it. But it was very interesting when I went to get my first shot. I saw, before they called me to sit, I saw a lady approaching the nurse who was going to give him the shot. And then she gave her 2 vials. So I immediately looked closely to see where she was going to place it, because I thought, because I already had this in my mind, that they had this special vaccine for Black folks. But she didn't give me those. And I was like, I'm so happy. But yeah.
So I'm sure that was a relief.
It was a relief.
Especially going into it, hearing all these concerns from other Black people and keeping an eye to see which vial you were going to get.
Yes.
And so you were a little bit assured knowing that it was the same vial that was going to be given to other people as well.
Yes.
Okay. So Rafifi, let me ask you the same question, whether you had any hesitancy in obtaining the vaccine.
No. I know the important, so I was very much ready for the vaccine. Mm-hmm. Vaccines protect us against infectious diseases. So with this deadly disease, I was very much confident that vaccines will help protect us against it. So I was very much excited when I had a chance to have the vaccine.
Okay, so I'm curious whether your background in healthcare helps you to make that determination.
Yes, I would say yes.
Yes, yes.
I mean, I look back, if you look back, you can tell that vaccines have helped the world in many diseases. It has prevented us from many, many diseases. We can look back to measles, whooping cough, and many other infectious diseases which impacted us, especially we in Africa. And it's very important that we all get vaccinated because I saw the need of getting vaccinated. So I was very much excited when I had a chance to get this COVID vaccine.
Okay. So the same question to Anta Beta, whether you had any hesitancy in obtaining the vaccine.
No, I didn't have. I was glad to get it. The way people are dropping dead, it was very scary. And I think I got a chance to listen a whole lot about the benefits of the vaccine. But prior to that, other vaccines that that is in the market already, that, for example, flu vaccine, I do take it every year because of the job I was doing. You have to get the flu shot. So when this one came in, I said, hey, even the big people are doing it. I don't think it will kill us. It's better safe than sorry. I know something has happened before, but I'm not thinking about the negative part. I was being positive. So I just went ahead, registered in so many different places, but my doctor's office did it for me. And I just went in and got it. 20 minutes in and out, that's it.
That's good.
And
That's good
I've
to
been
hear.
talking to people and advising, do it is good.
Yeah.
It's prevention is better than cure. So
Yes.
please be positive.
Yes. So, Auntie Jane, I purposely saved you for last because, as I mentioned, you're a registered nurse. So, I'm sure you could be biased as to whether you should get the vaccine or not. So, I guess we should still ask you because there are healthcare professionals who still have some hesitancy in obtaining the vaccine. So, would you share your reason for getting the vaccine?
Sure. And you're right. There are few healthcare professionals who are very hesitant about taking the vaccine. And at the moment, I'm encouraging all my employees to take the vaccine. And you'll be surprised how many, as much as they are out there seeing patients, are reluctant to take the vaccine. And just like Auntie Alberta said, and Brother Fifi said as well, we all know that vaccines have been in existence. We know of the measles, rubella, and mumps, MMR, measles, mumps, and rubella,
Marilla.
vaccine that children have to take, and school-age children are required to take the vaccine. So for me, especially being a healthcare professional, I know how important it is to take the vaccine. And also, years ago, you couldn't travel outside Ghana without your yellow vaccination card. Certain nationalities or countries won't let you in without vaccination. So we all know how important it is. And even for the ones that are hesitant, they've taken the vaccines, they've taken the smallpox, they've taken the measles. So at this point in time where there is a pandemic that's taking millions of lives, we really, really need to adhere. And again, prayers went up when the pandemic broke. We were praying for a breakthrough. And thank God the scientists, Dr. Eddie and his group, have gone through sleepless nights to ensure that we do get the vaccine. So for me, it was a no-brainer. And again, being a healthcare professional, we saw what happened and we see, I mean, people were dying on the news. You couldn't turn the TV on without seeing droves of people dying. Talking to nurses on the unit, as much as I don't do patient care or bedside nursing at the moment, I still talk to clinicians. So knowing what they were going through, anything that would help to alleviate the pandemic was what informed me. And again, as a nurse, you are teaching people to take better care of themselves. You are going to teach people or encourage people to take the vaccine. I'm not able to tell somebody you need to take your blood pressure medication if I'm not prepared to take the blood pressure medication. So I had to walk the walk. And for me, it was a no-brainer. I had to take the vaccine.
Thanks for sharing your experience. So before I turn it over, the next question to Dr. Eddie and to Martha, I have one more question for you regarding this segment because as I mentioned, and as you mentioned, you are a school teacher. So I'm curious as to whether other colleagues of yours, the other teachers in your particular school obtained the vaccine to be able to come to school, whether there's still some hesitancy among some of the teachers in obtaining the vaccine, if you're aware of it.
Yeah, I'm aware that some of my colleagues have refused to take the vaccine. And unfortunately, they are people of color. They were the same people who were speculating that in 5 years' time, if you take the vaccine and you're a woman, chances are you're going to turn into a man. I mean, it's some dumb stuff like, a teacher would say something like that. But that's the way they think, and you can't make them. They are refusing to take it. They've been begging them to register, and they even give us the link every day because of the kids, because it's good to return to normalcy. You want to feel free. You want to be prepared for everything. You want to have a free mind, because these kids come in, you don't know where they've been to. And they keep telling these teachers, they are educators. Can you imagine? But they keep saying, no, I don't know what is in there. I don't know what is in there. That is what they say. And that's why in the beginning, I knew I was going to get it. But I kept hearing all these negative thinking from these people, comments. And so, yes, they are so there. And I don't think those are going to get it. They are never going to get it. And it's very scary for some of us who already have taken both. And then they talk to us, even though we wear our masks, and they talk to us, they come and greet you. And sometimes we bump, shoulders. But it's still scary, but they're not doing it. And it's very unfortunate.
Yeah. Yeah. I think if you keep talking to them, who knows? They might
We just have to pray for them.
Yes. Yeah. So Dr. Eddie, do you want to take the next question, or we can't hear you on mute?
Yeah, so they've talked about their hesitancy, and most of them, I think, talked about the reason why they took the vaccine. But I would briefly, in a nutshell, I mean, we know that we have health workers amongst us, we have people who are well educated amongst us, but they are refusing to take the vaccine. So, what if we are to sum it up just in one sentence, or maybe in just one reason why you were motivated to take this vaccine? I mean, just the one reason why you were motivated to take the vaccine. I think it would sink into people. So if you could all tell us one reason why, just one reason why you took the vaccine, that would be helpful.
So you want to start with? Let's start with Brother Fifi Bediako.
Okay.
Okay. One reason I would tell anybody to take the vaccine is that it will protect you, or even if you don't care about yourself, it will protect other people against the virus. So if you not take it for yourself, just take it for other people. It will protect your family, your close ones, especially those with underlying illnesses. It will protect them from the virus, which can kill them.
So, Anta Beta, how about you? What's the reason, one reason for getting the vaccine?
Likewise, just like what Brother Fifi said, for protection. And then secondly, immediately I got my kids and grandkids were not able to get in contact with me. I miss them, they miss me too. But they were all looking out for me. So immediately I got the 2 shots. They just ran it. Even one of my daughters put it on Facebook. I've been able to meet my mom. He was so happy. But one thing is, I'm not scared of taking that. Just last year, I started getting all my shots again. They said 10 years it has expired. Pneumonex, you name it. So it's for my own protection. I just went ahead and got everything again. Tetanus, you name it. I've gotten all of it. So they said Nobody has to tell you anything. You see how people are dying. You see what is going on with other people. Look at the aftermath, the result. There is no cure. People are still, they are just like children again. They have, what is that, titanus, ringing sound. Some people are committing suicide. So why don't you prevent it and protect other people around it?
Okay, that makes sense. Auntie Jane, oh, thank you. Auntie Jane, we're asking you the same question. We know you're a healthcare provider. We know you had to get it, but what was your own personal reason for getting the vaccination?
Again, also for protection, because you want to be well. You cannot be there for your family. And just like Alberta was saying, I couldn't go next to my daughters or my grandchildren. And as soon as I got the vaccine, I felt comfortable, they felt comfortable enough to come by for family life. And we are in public. You and I are always in public. We deal with our coworkers. We deal with church members. We want people to feel comfortable around us. And as much as it's for protection, you want other people to feel comfortable around you as well, and to protect others. So that was my reason.
So, Auntie Martha, so what was your reason? You've heard some of it, but what was your main reason for getting the vaccine?
My main reason for getting the vaccination is to feel secured and then also have a sound mind for future uncertainties, because we don't know what is up at the front. So if you take it, whatever comes later is better. You've already been protected by taking it. So for me, security is the main role.
Okay, thank you. So I'm sure that there was different process for everyone's registration process, because a school teacher versus a healthcare provider, someone who's retired, who maybe in the age group that were given vaccines quicker versus Rafi, Bidiako. So we'd like to hear, how everyone's process was, and how long did it take for you to receive a response back after you registered to get the vaccine, and if possible, which county you received your vaccine in. And so let's start with Auntie Alberta. How was the registration process? What county did you get your vaccine in, and how long did you hear back after you registered?
Okay. I dealt with 3 places: my doctor's office, my congressman, 2 doctor's office, because I have my blood pressure doctor who registered me, my primary care physician also registered me, and the county, Montgomery County, also registered me. So, and they are doing it by age group. So they will update me every week about availability of time. So one day out of the blue, my hospital is messed up. They told me that, okay, I should go ahead and pick up a date. I think I saw it the day before. So I registered for the following day, and they sent me to Mesta in Only. I got there because I didn't know the Mesta in Only. I only go to Georgetown. So when I got there earlier, and they said, oh no, you have to wait 20 minutes to the time. Nothing. So I just waited a little bit, 20 minutes to my appointment. I got in, yes, I finished with my ID and this thing. I did it after the shot. I waited 15 minutes. They made the second appointment for me. But before I go forward, when I came home, I was talking to some of our church members who had their shots. And they were saying they went for the first shot, but they didn't make appointment for the second one. I said, no, whoever gave you the first shot is supposed to make appointment for the second one. I don't know whether, because that's what they did for me. That's what they did for me. So I told them, I said, you cannot wait more than 21 or 23 days. Call them as soon as possible to get your second appointment, because it looks like if you don't get the second shot on time, then the first shot is null and void. Whether it's true or not, I don't know, but I know you can't wait too long. So I advised them to call and get it. But I didn't have any problem. Just in and out, boom, boom, boom. That's it.
Well, the trials that they did suggest that you do have to have both shots. So having just one and not having two, at least for the Moderna and the Pfizer one, they do not have. Well, I guess they do have immunity, but their recommendations you have to have both for it to actually work. So you to get the 95% or the 94% of effectiveness, but you do have to have both shots. So that's good that you told them to make sure that they got registered for the next shot. But they are supposed
reasonable
to,
time.
right? They are supposed to give you a card, and I guess as we go around, you can let us know whether did they give you the card or not. But you are supposed to get a card that tells you when your first dose was, and then when the second dose is going to be, as a reminder. And then you're supposed to get emails and text messages as well. So it's unfortunate that those people were not informed of that process. So.
And that's not the only one. After you finish, they give you instructions, some pamphlets. And some people didn't get it. Some other location they didn't get. I did get one, about 2 sheets telling me what to do. They give you time that your 15 minutes will finish. So I think it's different from location. It differs from location to location. But where I went, everything was, okay.
Yeah, it differs from location to location.
Oh,
that is why we all sharing the experience for us to see, so that somebody wouldn't feel like I didn't get the right shot. So the same thing, if Uncle Fee, you had to tell us how did your registration go about? I mean, how was it? If you could share your experience with us.
Mine was very simple, very easy. It was so smooth. I never expected. A co-worker told me about the vaccine which are available at the time, and I made an appointment on Thursday I got one on the following Monday. So I made an appointment on Thursday. Monday, I had my vaccination. And I went, it all took me about 25 minutes because you had to wait for 15 minutes. So I went in, actually I went in earlier than my time, my scheduled time, but I was taken anyway.
That's just Auntie Jane, sorry. Go ahead, sorry.
Done.
Okay, so Auntie Jane, how was your process? And did your facility give it to you, or you had to get it within the community?
I got it in the community. I received emails were sent out. Actually, I received emails to decipher to the other team members. So as soon as I got the email, I sent it out to all the team members. And all you had to do was click on the site. There were 2 sites that were given to us on that email. And you click on the site, it gives you the available times, and you schedule your time. So for me, I believe it was on a Tuesday, I was able to get the appointment for that Friday. And I went in, walked straight up to the line, went up to the nurse, got the shot, and then had to sit and wait for 15, 20 minutes to see if there was going to be any reaction before I was let go. Again, like we are all saying, it's very important to get the fact sheets. And also you need to register, because for someone to call on you and check on you, you need to register. So it's important to register so they can call and follow up on you, because all the side effects or symptoms that we had need to be documented. So if we don't report those, they wouldn't know what symptoms people had. And also, I was given a card with the first dose documented on the front. On the back was the date for my second dose. So right there and then I knew when I had to go back. After I registered for the first dose, I received an email in 24 hours. And then also another email reminding me that I had to go in and get the shot. And it happened on the second shot as well. But it is important to register and also make sure that you have the fact sheets. And there's one thing that I want to say, because, we had a facade that take your Tylenol before you go in and get your shot, please. You don't want to mask any symptoms that you might get. So do not take any analgesic before you go get the shot. Now, after the shot, when you have pain at the site, you can. But please do not take an analgesic before you go in, because you don't want to mask any symptoms. Want to go in, just make sure you've eaten, go get your shot. After you come home and you have pain at the site, you can take the Tylenol. But please do not take Tylenol, aspirin, or what have you before you go get the shot, because you don't want to mask any symptoms.
Yeah, that's a good point, Auntie Jane. Because if anyone has some kind of reaction, they may not necessarily be able to voice it because they've taken a medication that will suppress that reaction. So that's a very good point. So did anyone take it at PG County at all? I heard Montgomery County. No one took it at PG County. Okay.
I took mine in Howard County.
You took yours in Howard County.
Yeah.
Okay. So when you registered on Martha, did it take a while to get a response back? How long? Because I've heard of a month.
For mine, it was like a month because they kept sending us the link, and all teachers will get on. By the time you get on and finish registration, they will say no available time. And so people were getting frustrated. And I believe that's the reason why other people decided, oh, forget it. Because initially we all were willing to take it. But because they kept tossing us up and down. And finally, after 1 month, I was home and my daughter called me, my youngest daughter called me and said, Mom, I got you in for tomorrow. I said, she said, yes, I got you in. But when I got there, we were in the line and they told us that they announced it. If you're a teacher in Howard County, get up from the line. Because our vaccines were at the central office. And if you were teaching at another county, you could stay in the line. Or if you were a daycare teacher, you could stay on the line. So a lot of the teachers left. And I said to myself, not this one here. I'm not. Because I was fed up. So I stood in the line and one of them came and said that, ma'am, are you a teacher in Howard County? And I said, did somebody announce that teachers should step out? She said, yes. I said, so why are you coming to visit? Because I'm Black. Immediately, she just gave way for me. And I knew that I had to do that to get. I'm sorry. But yes, I stood in line and I was like, okay, let somebody else come in. I was like, I'm not moving. And every minute they'll make an announcement. If you're in Howard County, please leave the line. Vaccines are not here. You get yours another time. I did not move until I got mine. The teachers got it the following week. And that is why my two friends decided they were not registering anymore. Those two friends who have decided yes. It was very, very hard for us. I don't know how. They would just send us the link. You get in the link and there's no available time for you to, but yeah, it took me about a month to get it.
You did get it, okay. I think because they've made it available to everyone starting with age 16, that hopefully it's much easier. I've heard that it's much easier to register to get the vaccines now. So hopefully the challenges that you had, people won't be having that as we move forward. So Dr. Eddie, do you want to take the next question? Can't hear you, you're on mute.
So I just want to ask them if they know which vaccine they took. By any chance, were you told that which vaccine you were taking?
So Auntie Jane, perhaps we can start with you. Which vaccine did you receive?
Yes. When I registered it, I was told what vaccine I was getting. I got the Moderna.
I'm getting Moderna. Okay. Auntie Abeta, which vaccine did you receive?
Pfizer.
Pfizer. Okay. And then Rafifi, which vaccine did you receive?
I took Moderna.
Moderna. Yeah. Okay. Auntie Martha, which vaccine did you get?
Moderna.
Okay, so there's three to one here, 3 Modernas. And so those who got the Modernas were able to go back, 28 days after the first dose? And then the Pfizer was 21 days or 3 weeks after your last dose. Okay. All right. And then all of you have completed your dosage. You've received both vaccines. Is that correct? Or?
Yes.
Okay. So let me see, what other questions do we have for you? Dr. Eddie, do you have another one, or you want me to go ahead and ask another question? Can you hear me? You're on mute again, Dr. Eddie.
Yeah, to prevent echo, sorry. So I think I have a combo question.
Okay.
So all of us on this platform, let's say all those that we are hosting, our guests have taken their vaccinations. So we know they experience some signs and symptoms which you cannot do away with it. And the CDC even tells us that women are more prone to more symptoms than men. So if you could share your symptoms with us, we would appreciate. I mean, all those in the house would know that it is not far from they have not deviated from getting the symptoms as you also had the same symptoms after getting the vaccination.
Okay, so Rafifi, do you mind sharing with us if you had any symptoms after getting either the first one or the second one?
Yeah, after about 15 minutes after the first dose, I felt very dizzy for a while, but then I wasn't alarmed. Then the second dose, which I took on February 8th, that was the worst symptom that I felt very dizzy, and I felt feverish, and also I felt some pain at the spot where I had a shot. For 2 days, I was very sick. But one thing I know about vaccines is that they all have side effects, like any other medicine. They all have side effects. But then, according to experts, the side effects of the second dose means your body is building up protection against the vaccine, coronavirus. So I was very much happy when I had that pain and all those things. I was very much happy because I know I'm being protected against coronavirus. I can proudly say I'm protected against the coronavirus.
That's good. I personally haven't heard of the dizziness part. I'm not sure if someone else has heard about it yet, but that's very good to know so that others could keep an eye on that as they get the vaccine, that if it's something that they get and someone else has experienced that. So Auntie.
Okay. What my brother is a doctor, and he went into the shot. So he also was dizzy. So he was the one who warned us that eat before you get the shot. So I was so glad when Sister Jane said that. So both doses, anytime I'll go, we ate before we got a shot. I knock on wood, whatever it is, nothing, no headache, no nothing happened for both shots. But I was prepared for the second one because the second one, they say, is a little painful or you can get reaction, but I didn't get anything. Likewise, my husband, no.
That's good. That's good.
But
Santa
I had before I went.
You ate before you went. Okay. So viewers, make sure you eat before you go for your shot. It's
maybe
work
you
for
were
2
hungry.
people.
That's why you're dizzy.
Auntie Martha, so did you have any side effects from either the first or the second dose?
The first one was sore, but the second one I was really sick. I mean, I had a shot on Wednesday. Thursday, I thought I was going to die. Honestly, it was that bad. I couldn't move. I couldn't do anything. But I'd rather be 6 feet above the ground than 6 feet under the ground. So I think it was worth it taking.
Did you report it to your doctors at all, or you just kind of weeded it out?
No, I did, but I couldn't also drive to go there. But they told me that they called and checked on me, so it just took a little longer because I took it on Wednesday. So Thursday and Friday I was home. I couldn't even go to work. But I think because people were talking about the side effects in the school, they already warned us that if you are going, make sure you have your supplants. And when I even emailed my principal that I was taking my shot that day, he said, good luck. And he said, tomorrow, whatever it is, just send an email or send me a text, because they knew that some of us were going to get sick. And people got sick. People were home for about a week. I don't know why, but I was home for 3 days, honestly.
Okay.
Yeah, but like I said, I feel that it's worth it. It's worth it. You need to take it. Whatever it is, it's worth it.
Yeah, before antigen comes in, so I would want to say.
You're frozen, Dr. Eddie. I think his computer is frozen, so we'll let him say that when he gets back. But Auntie Jane, so did you have any symptoms with either doses?
With the first dose, it was just a little soreness at the site. But the second dose was I had The pain at the site was more severe than the first one. I saw some redness at the site,
Mhm.
body aches,
Mhm.
nausea, temperature went up over 100. Of course, I knew what to do. I took Tylenol, just made sure that I drank a lot of water and stayed in bed. As much as I tried to sleep, I couldn't sleep. But yes, it's a good thing I took it on Friday. So Saturday and Sunday, I was basically out. But Monday morning, I was fit as a fiddle. I got up and went to work. Again, during that time, the thought that was going through my mind was, these are only the side effects of the vaccination.
Mhm.
Imagine having the virus itself.
Mhm.
For me, I think it was Brother Fifi that was saying that he knew that it was working, so he was glad he was getting the symptoms. But for me, it was a positive thing. And again, I was taking light of it. I said, "Oh, I know I'm getting immune because I'm getting all these side effects." Because we are educated about the side effects you're going to feel, it makes you feel a little bit. You don't get scared. You don't run to the doctor or what have you, because you're expecting. The fact sheets tell you what to expect, and that's how I do it.
Okay.
Yeah.
So go ahead, Dr. Eddie.
Yeah, so I'm saying that StreamYard gave me a message that it was from their end. I think they are having a
Oh,
challenge, a little challenge. So
okay.
what I'm saying is, I mean, signs and symptoms are inevitable. So in immunology, if you get fever, if you get headache, if you get sore, it is a way of your body generating T cells, T memory cells or memory T cells to fight against the COVID the next time it comes in. So it was good that you all had signs and symptoms. So everybody who is having signs and symptoms, it means that their system is working to generate enough memory cells to fight against the COVID when they encounter it the next time. So that is good to know. Thank you.
So I have a question before
I
we get
just
to
want
the.
to,
Go ahead.
can
Go
I
ahead,
interject?
Auntie.
I
Yes.
just want to encourage others too that when you go get the shot and you don't feel anything, don't think it's not working. Because as CDC says that women, get the most reaction. I had a colleague who was going for a second one. Again, I told her good luck. She emailed me the following morning. She was at her desk, and I'm like, "Are you serious?" So some people don't have it at all. So if you get your shot and you don't have any symptoms, don't say that you were given a placebo or what have you. You are getting everybody's system is different.
That's a good point. That's a good point. Auntie Alberta didn't have any symptoms at all. We have 20-year-olds who are like in bed for days after getting the shot. So it's very good to know that you didn't have any symptoms at all. I'm curious as to whether any of you registered. So CDC has Vaccine Safe that you can register after you get the vaccine, so that if you have any symptoms, you can then report to them so they can track it. So did any of you sign up for any of those tracking system in terms of follow-ups? So Auntie Martha, did you sign up?
As far as what?
So when you get the vaccine, they should tell you that you can sign up with CDC. There's a website you can go in and put your information in, and then you can report any symptoms that you have with them, so they can then track it. And then see who else is getting similar symptoms, and they can share with the public. But not everyone is being told to
I was
sign
not
up for
told.
that. Okay.
I wasn't told.
Okay. All right.
Maybe they
And
assume I knew it. I don't know. I didn't know.
yeah, and then even the state, I should say, it's the state of Maryland also could track it, and then the county also do track it. But you do have to be told to submit your information for them to then track it. I know I've registered a couple of people with CVS, and then they also do track if you have symptoms or not. So Auntie Bertha, you didn't have any symptoms, so there's no point of you.
No, but I did get a survey.
Okay.
It came from it, but I didn't do it.
Okay.
Because I'm sick and tired of going to work. I didn't do it. But I did get it, that message.
Okay. Well, it's not too late. Whenever you're bored, please go ahead and complete that survey, because
What is it? What is that for?
It just they will tell you, they send a survey, said they want to know your experience at the place.
Yeah, because I know I didn't tell anybody about my school pools, the county pools names of teachers who already had it. So they will every week they tell us, oh, only 20% of the teachers have their second dose, only this. So I was wondering, why
How
they
did
had
they-
or how they got that data. But that's why, maybe that's where they got it from. But
Yes, that's probably
Oh.
where they got it from. They have a list, like you said, of teachers from your county who have received the vaccine, who haven't received the vaccine. I know at NIH we do get emails telling you it's your turn to get the vaccine. You have not responded to get the vaccine. So almost every company is tracking, especially public or public health positions. They are tracking us to see whether their employees or staffers are getting the vaccines or not. Santi Jane, did you complete any type of survey?
I did, and I think I mentioned it as well that we need to enroll in that because that's how CDC, NIH, or what have you track the symptoms that we are getting and to see the severity of it, and if to educate the masses. Just like we heard of Johnson and Johnson, only a couple of people get in the class, but if they don't follow through, they wouldn't. Nobody would know. So it's important that we report whatever symptoms we do get for data.
Mm-hmm. Okay. So we may have skipped a question, Dr. Eddie, which is whether everyone's family has received the vaccine up to now. So I know, Auntie Betha, you said you and your husband have received the vaccines. Have your children received the vaccines as well, if you're aware of it?
Last one. That's the last one.
Mm-hmm. The last one has
She's been scheduled for next week. Yeah.
Okay. Okay. How about you, Auntie Martha? Have your entire family received it, or they're working on it?
We've all had, three of us have, I don't know about my oldest daughter, but my youngest daughter, she has both. I have both. My son has the first one. Okay. And I think my oldest daughter has the first one too.
Okay.
Yeah.
Okay. How about you, Auntie Jane? Has your family received it?
Other than my daughter in Ghana, who hasn't had the shot, my son is going to get his first dose on Thursday. Others have fully vaccinated.
Okay. How about you, Brother Fifi?
Only one of my daughters hasn't been vaccinated. That's the younger one that lives with me. Mm-hmm. Other than that, all the others have
been vaccinated. My
daughter who just went to Ghana, she also hasn't received the vaccination. But they have all received the full dose of vaccine.
That's good. So we asked this question because obviously the more people who have been vaccinated in a household, the more people will be comfortable in visiting and traveling with each other. So and there are obviously different age groups. So we're kind of interested in knowing, whether the adults have received it, whether the kids have received it. And so it's good to know that at least some members of your family has also received a vaccination. Ajay, did you have another question? You're mute again.
Sorry.
That's
so
okay.
a lot of experience shared. I mean, my question is, from these experiences, would you recommend COVID-19 vaccination to others?
So we can start with Brother Fifi. Would you recommend it to others?
Yes. Yes, because there's evidence that people who are fully vaccinated are less likely to infect other people with the virus. And also they can protect themselves from the virus. So I will always recommend that people should take the vaccine so that we can at least come back to normal. Normal, I mean, pre-pandemic times at the church. So I advise everybody to at least take it if you haven't taken it yet.
Okay, so Auntie Martha, we'll put the same question to you because before getting a vaccine, you heard of all the myths, and then you decided that it was safe for you to get the vaccine. So would you recommend others to get the vaccine?
Yes. I'll tell them, for a sound mind, it will be better for you to get it. So even if you are not thinking about yourself, think about your family, think about your co-workers, think about people that it might not kill you, but you get it to kill somebody in your family. So if you love your family, please get it. I've been telling them, get it and get it and get it. And it's not waiting time. Just get it now to be on the safe side. Yes, I will.
Okay, Auntie Betha, how about you? Would you recommend the vaccine to others?
Definitely, yes. I've been doing it already, convincing people to take it. It's for their own protection. It's for your friends and family's protection. You have to do it. We need to get back to normalcy. We miss our socialization. Right now, we've been at home for almost 1 year. No tech service. Some of us, not everybody. We need that socialization. It's healthy. And we have this asymptomatic people out there who don't know even they are carriers. So at least get the shot and protect yourself and protect your friends and family too.
Okay.
So definitely, I will recommend to anybody who will listen to go and get it.
Okay. Thank you. Auntie Jen, how about you? I think Eddie and I know the answer, but we're going to ask you anyway. Would you recommend?
I will definitely recommend, and I also want to say that we are not out of the out of the woods yet. But as humans, we tend to think that if it hasn't happened to me, it's not out there. And maybe some people don't know someone who's been infected and died, but lots of people have lost their lives. So it is that important, and we will plead to all, both church members, our family members, those listening, please do get vaccinated because you get protected. And like we are all saying, just a glimpse of the symptoms, it's even scary enough. You might think I'm very fit, I'm drinking my Sobolo, I'm drinking my ginger tea and all that. It's good, but you never know when you're going to get it. And we're not saying that can even protect you. So it is that important, and we are pleading to all. I know of people who have died. Had a nurse who was out for 2 months. She was on oxygen. She just got back to work last week. And it was scary. It was scary. I mean, it's a good thing that she was able to tell her doctor, I'm having difficulty breathing, and the doctor ordered oxygen for her at home. I was telling my clinical manager today, I'm only wondering what if she had ended up in the hospital. It could have taken a different course altogether. So it's no joke. It is no joke. The fact that you don't know somebody physically who has been infected doesn't mean it's not out there. It is. Please get vaccinated. And if you live in Montgomery County, call me. You need to get vaccinated.
So this is a follow-up, which is our final question. Okay, go ahead. Go ahead. Okay. I was going to ask that obviously we are recommending people to get the vaccine, but you have those who are very adamant that they are not going to get the vaccine. So how would you encourage them to get the vaccine? Which is a separate question than you would just recommend, but how would you encourage them to get the vaccine? So we'll start with Brother Fifi Bediako. You're on mute. Okay, perfect.
First of all, if I should know someone like that, I'll try to find out what the person's reasons are for not taking the vaccine. Then I will handle it from there. I will provide education to the person, the importance of having the vaccine. Because we know from ages, we know that vaccines protect us from diseases, infectious diseases. And one of the most important achievements in public health is vaccines. Having vaccines. So I will try to educate whoever is hesitant in taking the vaccine.
Okay. Tamata, how about you? How would you encourage your colleagues, the teachers who are not willing to get the vaccine?
Well, once in a while, we go out and hang around. So now that people are not getting it, we can't do that. So I would tell them that, look, we need to go out. Like Auntie Alberta said, we need to hang out, go out and just, chill, go to the movies or somewhere, or go eat in a restaurant somewhere. But we can't go because maybe you don't have your shot and I don't feel comfortable around you. So it would be better for you to get it, just so we can have our normal life, and then we all have our peace of mind, and to be able to be with our friends, and not being afraid that this person is gonna, infect me or something like that. So I'm still doing it, and I hope gradually they will yield to that and get it, because it's very important. That's life.
Yeah. So Auntie Alberta, how would you? I know you said you've already started encouraging people, but how are you encouraging them to get the vaccine?
Okay. CDC says, except for spiritual reasons, you are exempt from it. Okay. So I'm not going to meddle into your affairs, but I will ask the reason why you don't want to get it. And then I will explain to you. I will go ahead and give you examples. Sometimes maybe examples will help. And that's where you get the flu vaccine, mumps, and all those things. We've taken that because it's for our protection. So I will give you those examples that it helps. So just look at it and please try and take it. This is not a guinea pig thing. It happened in our own eyes. We saw it. I remember I stopped watching TV in the news because in the morning when the COVID came at first, I just cried and cried. I don't even know the people, but the way they will show it, people just dying. It was too much. So why do you want to do that? Why do you want to hurt your family? I will try and use all avenue to convince you to get it. And that negative idea that you have, I will see whether I will be able to knock that negative idea out of your mind.
Okay, thank you. Dr. Eddie, before we go to Auntie Jane, do you have any comments from our viewers or any that we should share? Or
I think they are saying that it's better to get a shot than to be shot. Get over it and let's shoot our COVID-19. And then we have the spirit of fear is not from God. 2 Timothy 1:7. For God had not given us the spirit of fear, but of power and love and of sound mind. So I think it's encouraging. Viewers are really participating, but they are not asking questions.
Okay.
Yeah.
Okay. They may have similar experiences as our panel.
Yeah, I mean, I think they are clapping, congratulating, and giving a sign of like relief from hearing what our guests are saying. So I think I'm watching. I have taken the vaccine. Okay.
Oh, good. Good.
And so we think from these reactions, we think they are fully behind and
getting
enjoying
the vaccine. That's awesome. So Auntie Jane, come to you, our healthcare provider on this panel. How would you encourage others to get the vaccine, those who are so hesitant about getting it?
For the same reasons I had cited earlier, the number of deaths, and like Alberta was saying, those sites, the vivid sites, and I used to think to myself, the residents in New York, the ones that live like next to the hospitals where they had these 18-wheelers, refrigerated 18-wheelers on the street, parking the bodies. These are things that happen. I mean, this is not a story. It's not a story. It's something that happened. So if not, and like I said, we are not out of the woodworks yet. And there's even there are more variants of the virus. So it's that important to get vaccinated. And I did ask one nurse why she hasn't taken it. She's not at bedside, so she thinks she has an excuse. And I asked her, she said she was waiting for the Johnson & Johnson. So with the news now, I actually went and got the forms from the doctor's office and gave it to her. She filled it out and she did schedule her vaccine. So yes, the onus is on us to, hammer it in. And the more people that can get vaccinated, the more we would have herd immunity, because we need to get back to some kind of normalcy. It's not going to be 100%, but at least we can be comfortable around each other, because those that are vaccinated can, hang around each other. So it's that important that we'll continue to encourage individuals to get vaccinated.
Okay. Well, thank you all so very, very much, Dr. Eddie. And I thank you.
The last one on
go ahead.
The last one on the right
Okay.
side. So, what weird thing did you hear that after taking the vaccine, it never happened to you?
That's a good one. Let's start with Auntie Martha.
Before you took the vaccine, you heard a lot of things, a lot of weird things, weird myth stories, untrue, unfounded stories made you heard a lot. You took the vaccine, and that thing never came true. What did you hear?
Auntie Martha, we'll start with you.
Well, I heard that the vaccine for Black people, if you take it 2 years, between 2 to 5 years time, if you're a female, you would turn into a male. And I was like, okay, give it to me. Up to now, I'm still a female. So whatever they said was a conspiracy theory. It did not work.
It did not work. Okay. Brother Fifi, what crazy story did you hear about the vaccine?
I heard that they put some chip. Once you are vaccinated, there's a chip in the vaccine which is inserted in you, and you are just a government property. You can monitor wherever you go. And but when I heard about that, that was funny to me.
Mm-hmm.
Funny to me because I know what vaccines do.
Mm-hmm. Mm-hmm. You're in public health as well, so
I
you
know
can
what-
prove that no one is following you around,
yeah.
and there was no chip inserted into you. And tell Betha, did you hear anything interesting about getting the vaccine?
Yeah, I heard it on the news that they are bad mouthing poor Bill Gates. And this is somebody who has donated $2 billion to help to find a vaccine for us to cure us. So I know I didn't even want to listen to it because I know it's trash now. And then they are talking about him. He wants to control the whole humankind. So if he wants to control us, why is he sending the chip to China for them to do it? And sometimes you have to analyze the things you are hearing. So nah.
I have to put things in perspective.
Yeah.
Auntie Jane, did you hear anything interesting before you got the vaccine that obviously did not occur?
Again, with the chip, and so in my mind, I'm wondering how the chip, will disintegrate into a needle, get into your arm, and then coagulate or whatever, form a chip. That I couldn't process that. So for me, it wasn't true, and also that it was a way of exciting Black people. We live in an area with diverse ethnicities, so that for me, that didn't hold water either. So none of those.
Came to fruition, and where everybody's here, healthy, and we thank you. We thank you for sharing your stories and your experiences about getting the vaccine this evening. So we hope that you'll be able to join us another time on another topic. And thank you so much for taking the time to have this discussion, a very important discussion for our church members. Dr. Eddie, do you have anything else to say before we say good night or good evening to our guests? You're on mute. Okay.
Yeah, so I think we've had a night. I think a long story. Is this a story or a message? Oh yeah, so somebody people sharing their experience. That the day I took the first dose was the day Ghana got their vaccine, and people were saying they are not going to receive it. I encouraged them with the pictures I took for them to make sure they take. There were so many questions about it, but I still encourage them to. Yeah, so there were so many stories, unfounded stories out there, but I mean, people are taking it, and it is protecting the public, and that is the most important thing.
Yeah.
Thank you very much.
Yeah. Thank you. Okay, thank you. Thank you again. And we appreciate your time this evening. And we hope I will be bugging every one of you. Everyone in here has different experiences. And so we will be contacting you to get into another segment of You and Your Health. So thank you again and have a wonderful, wonderful evening.
Thank you.
Thank you for inviting us too.
Thank you.
Good night.
Bye-bye.
Good night. Bye-bye. So family, we hope this discussion was beneficial to you and your family. COVID-19 remains very much real and can cause severe illness and death. We can't tell you how important it is for you to get your vaccines. You've heard it from 4 prominent members of our church community who have received their vaccine and shared their experiences. And they recommend and encouraging you to also get your vaccine. So we urge you to consider getting the vaccine. It will enable all of us to get back to some type of normalcy. I'm looking at the names we joined. Thank you for joining our viewers. So Dr. Eddie and I will be back next week with our new guest, Ms. Summers, on how to help a special education students excel during virtual learning. And as I mentioned, Dr. Barbara Intua's book is here. You can get it on Amazon, but she's already ordered 25 copies of us for us, and it will be cheaper if you get it from either Auntie Jane, myself, or Dr. Eddie. I believe it will be $25 versus $32 on Amazon. So if you are interested, please reach out to us and we will get it to you. And again, she'll be back next month to talk about cervical cancer. So if you have any questions or comments, we ask you again to please submit it to emcuandyourhealth@gmail.com. Again, that's emcuandyourhealth@gmail.com. As always, please continue to stay safe, wear your mask, wash your hands, and social distance. And again, if it's your turn to get vaccinated, we do ask that you please consider and register to get vaccine. Thank you again for watching, and we hope to see you next time. Have a good evening. Bye-bye.